Today I'm going to talk about epidurals for pain. Cortisone, also known as corticosteroids, or more commonly steroids, are the common ingredient in cortisone shots and epidurals. Before I had an epidural, I knew very little about them. I had heard of anabolic steroids that athletes used, which could cause a lot of problems. And I also knew of someone who had taken steroids prescribed by their doctor in a pill form, and they had stomach problems afterwards. I had heard of some people that were helped by epidurals and some who were not helped. I definitely was not helped by them. My condition became drastically worse to the point where I had to crawl. I thought, I need a chair with wheels. As I said in a previous video, I was having a hard time using my legs, and I did not know that antibiotics were to blame. I had a test called electromyography, also known as an EMG, which I think really stands for extreme massive groans. The test showed that I had a possibility of piriformis syndrome and Facet syndrome, which is basically arthritis of the spine. The piriformis syndrome is related to the piriformis muscle, which helps you to walk, and it's located in the glutes. After the EMG test, I was sent to a pain doctor, and he said that I had a pinched nerve in my spine. What he told me did not, in my opinion, line up with the way I was feeling. Most of my pain felt like it was coming from deep within the hip area on both sides. I was not happy with that explanation, so I canceled the epidural and I researched what piriformis syndrome was. When I couldn't find any other doctor who could give me a good explanation for why I was not able to use my legs properly, I decided to reschedule the epidural, which was about a year later. In the meantime, I told my chiropractor that I had found a suggestion in an article on piriformis syndrome that ultrasound treatments could help this condition. Ultrasound basically is a form of heat. So maybe about a month or so before the epidural, he started performing the ultrasound treatments. And just a few days before the epidural was scheduled, I began to make a lot of improvement. I felt so good that I went on a cleaning frenzy. I had a limp, but I could walk. I kept the appointment for the epidural because I thought, if I feel this good now, just think how good I will feel after the epidural, because I would have some good days and then a bad day to follow. So I thought, why not? I barely looked at the paper they gave me explaining the procedure. But now I want to share with you what the paper said. The epidural contains a steroid medication.
Here's the actual paper titled Therapeutic Coddle with Epidurogram. To summarize, it evaluates scar tissue and dissolves it around entrapped nerves in the epidural space of the spine. Dissolving scar tissue allows medication to reach the area. Although I did not have back surgery or a ruptured disc, these can be the cause for scarring. The procedure is done in X-ray using fluoroscopic guidance to insert a small catheter into the epidural space of the spine. 3 epidurals are given approximately 10 days to 2 weeks apart. Besides cortisone, it contains a local anesthetic, X-ray contrast dye, and a salt solution to soften scar tissue. You can return to work the next day. So how bad could it be? The procedure is generally safe. However, there are risks. The most common side effect is pain, which is temporary. The other risks involve spinal puncture with headache, infection, bleeding inside the epidural space with nerve damage, or worsening of present symptoms. The other risks are related to the use of cortisone. These can include weight gain, increased blood sugar, water retention, and suppression of the body's own natural production of cortisone. Excuse the marks I made when I decided to finally study the paper years later.
I put the paper aside and tried not to think about the risks. However, I should have paid very close attention to the warning that said my present condition could become worse. I never recovered from the damage done. I held on to the belief that the epidurals would cure me. I didn't even want to acknowledge the words on the page that said, "The cortisone used in the injection starts working approximately in 5 to 7 days, and its effects only last a few months." That's it. I was told that they normally give you 3 epidurals. So I went back for all 3 because it was standard procedure. Nothing made sense about getting injections into my spine when I was having a hard time walking. I have to apologize. I just looked at some of the video I shot and I heard my robot vacuum in the background. I just can't re-record what I recorded because I'm running out of time. I was just going to say that the epidural felt like an alien abduction because I never experienced anything like that before. So just pretend that the sound of the vacuum is a flying saucer overhead. The first epidural was a 10 on the pain scale, but it was over before I could think about it for long. As I waited in the recovery room, I saw patients walking out after their procedures. I don't know if they had had epidurals also, but my legs turned to mush and I requested a wheelchair to get out of the building. They told me that the site would be tender for a few days and I could use ice and pain pills. I had a headache the next day, and the pain was so bad that it landed me in bed for several days afterwards. That did not surprise me because I knew my body and it usually took me a while to recover from things, so I wasn't too disappointed. A few days later, I did notice a little bit of an improvement in the pain in my low back, so I was happy about that. No one at the pain center told me when I could start my normal routine, so I just decided to start exercising that week. They were only 4-pound weights, and somehow I threw out my shoulders and my neck. I had a nauseating headache, and then I started to vomit, and I could not stop. I instinctively knew that I needed to go to the chiropractor. After the adjustment, within an hour, I stopped vomiting. Oh, and I forgot to say that the vomiting turned into dry heaves. That was really fun. My chiropractor explained that the body will purge when your neck or your low back goes out. I pretended I was doing fine. I cleaned my car. I took my grandmother shopping. We had a little family picnic that I went to. The day after the picnic, my hips were hurting. I wanted to get more cleaning done before the second epidural, but I discovered that the energy I had before the first epidural was fading fast. I struggled to lay still on the cot before the second epidural, and the girl that brought me into the surgery room said that Sarah, or whoever she was, would hold my hand during the procedure. Well, she did not hold my hand during the procedure. When the girl came back to get me, she asked Sarah if she held my hand. And Sarah said, no, I couldn't hold her hand because her heart was beating really fast. The second epidural seemed to go on and on. I felt like I would fly off the table, like putting your finger in an electric socket. A moving current of pain traveled from my tailbone and into the front of my pelvis. I cried uncontrollably, and I said, I can't take any more. The doctor reassured me that it was just a little bit longer, and when it was over, he came over to me, put his hand on my shoulder, and said that I'm sorry, that this is going to help you. And I just said, I know. And then I said, that was the spot. And he repeated to someone, that was the spot, so they must have made a note of it somewhere. I had a mild headache later that day, then a nauseating headache the next. I called the office and I spoke to a nurse who said to lay flat on my back. The following day, I called the office again because I still had a headache. I spoke to another nurse who said if it was related to the spine, I would have a headache so bad that light would bother my eyes. Regardless, the more I moved around, the worse it got. I spent several days in bed after the second one. I missed another band night that my kids were in at school, and I felt like my kids were growing up without me. I must have been so desperate to find a cure, because no one would ever go back for more. But there I was, 9 days later, having the third and final epidural. All the epidurals were different, and the doctor would always ask me which side was worse, and I wasn't really sure what to tell him. It was really difficult to know exactly where the pain was coming from. After the third epidural, I woke up without a headache. But when I went into the bathroom to brush my teeth, all of a sudden, everything started going black. I squatted to the floor, then sat on the stool in my bathroom until I felt like I could make it back to bed. I couldn't make it down the stairs to fix myself lunch, so I just snacked on some chips that I had on my nightstand. A week later, I found myself stranded in my basement after I threw a load of laundry into the washing machine. I could barely make it to the steps, and I just held on to some boxes that were stacked up on the floor. And once I got to the steps, I started crawling up the steps. And I thought about calling 911, but I thought, well, how are they going to get into my house? So I just pulled myself up using the banister, one step at a time, made it to my couch, and stayed there the rest of the afternoon. I didn't know what else to do, and rest always seemed to help in the past. I thought it would just be a matter of time, and I'd be able to function again. When I went back for a follow-up appointment, one of the doctor's assistants recommended I have nerve blocks next. The injection site would be between the facets of the spine. The facets are the tiny bones along your spine. I thought that I had to try everything available to me, but little did I know what I was getting into.
This article, courtesy of Medline Plus from the National Library of Medicine, is titled Steroids. Briefly, steroids reduce inflammation and affect the immune system. What I really want to point out is that steroids are strong medicines and they can have side effects, including weakened bones and cataracts. Because of this, you usually take them for as short a time as possible. This article was updated May 16th, 2016. And today is March 29th, 2023.
Join me on a future video when I will discuss the other procedures that I had and which ones were helpful. I tried prolotherapy, PRP, which is platelet-rich plasma injections, and acupuncture. Acupuncture seemed to help me the most. My insurance did not cover prolotherapy, PRP, or acupuncture. It did cover the cost of the epidurals, but just because insurance covers a procedure doesn't mean it's the best choice. Until next time, I'm B.A. Limbeck, and if my story can help one person, the pain I experienced will be worth it.